All right. Hello, everyone. Welcome to today's research seminar titled Food for Thought, Insights into Neuropsychology and Nutrition. My name is Lily, and I'm one of the program assistants for the BC Brain Wellness Program, and I will also be your MC for today. Before we dive in, I do want to take a moment to acknowledge that the BC Brain Wellness Program at the Javad Moafeyan Center for Brain Health resides on the traditional, ancestral, and unceded territories of the Musqueam peoples. As a settler here, I think it's really crucial to recognize the profound relationships we have with the Indigenous peoples and the land, and to continue to honor and nurture these connections. It is truly a privilege to be able to offer our program on Musqueam land. And as we join from various locations today, I urge each of us to pause and reflect on the history of the land that we inhabit. You can learn more and explore more about the land's history through the resource provided in the chat. So let's now dive into introducing our guests today. So we not only have one guest, but we have two guests for you today. So we have Dr. Noah Silverberg and also Yolanda Wang. So a little bit about Dr. Noah Silverberg. So Dr. Silverberg completed his PhD in clinical psychology from the University of Windsor. Before joining the UBC Department of Psychology in 2020, Dr. Silverberg worked as a staff psychologist at GF Strong Rehab Center for over 10 years, where he also led an interdisciplinary brain injury research program as a clinician scientist. So Dr. Silverberg is interested in the psychosocial determinants of health and neurological disorders, particularly concussion and traumatic brain injury. And his research program aims to better understand the psychological mechanisms that perpetuate symptoms after concussion and also related health conditions. And we also have Yolanda joining us today. So Yolanda is our registered dietitian, and she's also a ACSM certified personal trainer. So as a UBC alumnus herself with a dietetics major and kinesiology minor, she is really passionate about working with clients to develop a healthy and satisfying lifestyle. She has actually been working more so on the research side here at BC Brain Wellness under the supervision of Dr. Silky Cresswell, providing nutrition education and also cooking together with research participants. Before joining the program, she actually worked as a dietitian in acute care, gestational diabetes, and also long-term care facilities. She is really excited to introduce the nutrition piece to the comprehensive lifestyle and also wellness projects here at BC Brain Wellness. So we have two guest speakers, so that means we will have two separate presentations. So we will start off with Dr. Silverberg, who will explain what a neuropsychological assessment entails and its role, delving into the differences between cognitive screening versus detailed neuropsychological assessments. He will also introduce a new cognitive health class offering that will begin in the fall. And then Dr. Silverberg's presentation will be followed by Yolanda's presentation. So Yolanda will share the available evidence on the role of nutrition in relation to brain health, as well as discuss the upcoming BC Brain Wellness Program nutrition programs. And before we dive in, I do want to take a moment to thank all of our program donors for supporting the Brain Wellness Program. It is because of your generosity that we are able to continue to provide these accessible educational events and also classes. As an entirely donor-funded program, we rely on your generosity to ensure the continuation and development of our program. So thank you so much for your ongoing support. All right, so without further ado, I will pass on the Zoom mic to Dr. Silverberg. So the floor is all yours. Welcome.
Thank you, Lily, for that introduction and the BC Brain Wellness Program team for having me on. I just learned a moment ago that you had a neuropsychologist presenter last time. So I hope there won't be much overlap and the content today will be complementary. Lily mentioned a little bit about my research interests and program. That is not what I'll be talking about today. I have my clinician neuropsychologist hat on. Yeah, so this picture kind of says it all, but it's hilarious to me because it's a neuropsychology sort of inside joke, I suppose, but I'll walk you through it. There are some misconceptions about what neuropsychologists are and what they do. We don't read brain scans. We don't put people on the couch and analyze their dreams. The procedures we use for assessment are also non-invasive, contrary to what a lot of our patients expect when they show up, nervously about being poked and prodded. It's nothing of the sort. The cognitive testing that we do is mainly paper and pencil, some on the computer, but basically you're just, asked to remember things and solve puzzles and that kind of thing. The TV show House MD, I don't know if anyone remembers that from the early 90s. It was one of these sort of medical investigation dramas. So that this Dr. House inevitably at the end of the day, stepped into this medical mystery, a patient with these puzzling symptoms and nobody could figure out what was going on. And he steps in and, connects the dots and saves the day. That almost never happens in neuropsychology. Sometimes it does, and it's cool, but that would be the rare exception to the rule. The reference to what I'm supposed to do, it shows somebody actually administering cognitive tests to a patient. Neuropsychologists actually don't often, or certainly not always, participate in that activity. We work with testing technicians, a bit like radiologist technicians, I suppose. These are trained professionals who are really good at administering the tests, and then the test results and scores come back to the neuropsychologist, whose job it is to make sense of them, explain it to the patient, come up with a diagnosis, convey all that to the referring physician, and so on. And the reference to what I really do, sort of being buried in paperwork, is we spend actually a fair bit of time analyzing numbers in front of us and writing up reports and that sort of thing. So I hope you found that at least, some tiny bit as funny as I did. Okay, so a neuropsychologist is a clinical psychologist with specialty training in the areas you might imagine are important for doing this kind of work. So neuroanatomy, how the brain is laid out and how it works and what goes wrong with various neurological diseases and what kind of symptoms and problems to expect, and then some training in advanced assessment techniques. So it's a clinical PhD where trainees are in sort of supervised practice, seeing patients, typically for several thousand hours before they're eligible for licensure or registration as an independent professional. And then once in practice, what neuropsychologists do are assess and treat cognitive and psychological or neurobehavioral disorders in people with different kinds of brain injury, illness, or disease. So I'll give a lot more detail about the assessment part. That probably makes up for the bulk of how a lot of neuropsychologists spend their time is doing what are called neuropsychological assessments. So these are detailed evaluations of different kinds of thinking or cognitive skills, such as attention, memory, problem solving, etc. So we administer a bunch of tests and then put the sort of test scores together to try to make sense of them, and also taken together with other sources of data, such as what the patient tells us, what their family member has observed in them, how our observations from how they go about the testing and so on, and come up with some opinions about what is wrong, as best we can, why it, what is the cause of those difficulties they're having, where is this going in the future, so some kind of prognosis related opinions and so forth. And what we're able to do is put together kind of a profile of cognitive strengths and weaknesses. So this, even, healthy people with healthy brains have strengths and weaknesses, but these are often amplified in the context of brain disease, where people have some pretty major weaknesses or impairments. And so we're just trying to get a clear sense of exactly what those are. And this can often help diagnosis. So come up with a clear idea of what's going on with somebody, and also inform management or treatment. So I'll just say a little bit more about what neuropsychological tests look like, and then I'll show you a couple of examples to make it a bit more concrete. So these tests are all highly standardized. So they're given exactly in the same way to everybody. We have very detailed instructions for how they are to be administered and scored and so forth. One outcome of that is reliability. So it doesn't, or at least it shouldn't much matter which neuropsychologist you're seeing or which technician is administering the tests. The tests are always administered in the same way, and you should get the exact same numbers no matter who's testing you, or even if you're seen by the same person and some time has passed in between, we can compare apples to apples because of how the tests are standardized and reliable. The other benefit to having standardized tests is it allows us to do norm referencing. So sort of like when you get your blood drawn and you get all these values and it compares your values to some quote unquote normal or expected range. We have a similar thing in neuropsychology by administering the same test that we use for clinical purposes to hundreds or thousands of healthy people. It allows us to compare your score to people who are like you in important ways, similar age, education, background. And that also helps us to make inferences about what how low are low scores, and do they likely represent a decline or impairment for you, because we're making a prediction about how you should be performing based on how others who are like you perform. The tests are also pretty hard, and some of them get harder and harder as they go along, to the point where nobody can get 100% on it, which is different probably from a brief cognitive test you might have done in your doctor's office. Or another example, if you've heard Donald Trump brag about acing the cognitive exam, the one he is referring to, it's called the MOCA for short, where he scored 30 out of 30, which is of course the best score you can get. But it has a major ceiling effect. In other words, almost everyone who doesn't have dementia or cognitive decline gets 30 out of 30, and it can't tell you about cognitive strengths and weaknesses, only that you don't have dementia, probably. A couple other things about neuropsychological tests. They're developed so that poor performance corresponds with certain brain regions or networks. We know this from putting people in brain scanners while they do the tests, or from studying patients who have small lesions because of a stroke or tumor. So if that part of the brain is damaged, we should see poor performance on the corresponding test. And then the tests, at least in some ways, maybe not directly, tell us something about how somebody performs out in the real world. So just to give you a sense of what these tests can look like, I'm going to show you a couple examples. Whoops, not sure why it's advancing, and have you follow along as if you're taking the test, okay? So for this first one, you're going to see an object at the top of the screen, and then two objects at the bottom. And your job is just to say left or right, matching the one on the bottom with the one on the top based on an attribute that I will tell you. So either matching on shape or matching on color. Okay, so each time I advance the screen, your job is just to say left or right. Okay, so we'll start with this one together. So notice the instruction, we're matching on shape here. So the correct answer is left. Hopefully you're with me. We're going to go through some more and try to answer as quick as you can. Just notice shape or color and say left to right as quick as you can. Ready? Here we go. Yeah, so what you might have noticed is that started out okay, but got pretty hard. Especially when you had to quickly switch back and forth between color and shape. And that gives us a measure of cognitive flexibility, or your sort of the fluidity with which you can sort of shift your thinking or the way that you're paying attention to something. Okay, so that's one example. We're just going to go through one more example. This is a test of what we refer to as working memory, or your ability to keep bits of information in your mind or mind's eye and manipulate or work with that information, such as reordering it and so on. So that's what we're going to do here. I'm going to show you a series of pictures one at a time. Each one shows some kind of creature, but they're in kind of a random order. And then as soon as I'm done showing you this series of pictures, I'm going to ask you to say them back from memory in order from smallest to largest. So don't worry about the size of the picture on the screen, but like in real life, what these creatures represent. Okay, so I'm going to show these to you. Just remember them. Okay, now tell me the creatures in order from smallest to largest. Okay, so probably a few of you were able to do that. I gave you quite a few things to hold on to in your mind, so that was a pretty challenging one. And typically the way these tests work is we start with a small number and kind of work our way up to till it gets harder and harder beyond the point where anyone can get everything correct. Okay, so that was sort of zooming in on what neuropsychological tests look like. They just showed you two examples, but there's quite a variety. And now I'm just going to zoom back out and talk about neuropsychological assessment and the situations and when it's helpful when your doctor may want to put in a referral for one. One of these scenarios is to get some clarity about diagnosis. So there are some neurological diseases that we can sort of detect with confidence based on blood tests or genetic testing or brain scans, but there are others like the early stages of many dementia, neurodegenerative conditions where their brains look pretty normal. And it's only through neuropsychological testing that we can sort of tell the difference between somebody who's just getting older and there's no neurological disease versus somebody who's starting to show significant decline. And there are some other circumstances, but that's one situation is with diagnosis. Another thing that neuropsychological assessment is helpful for is really getting a clear idea of the impact of injury or disease. So even if we have a clear diagnosis like Parkinson's disease or Alzheimer's disease or what have you, that doesn't tell us exactly how somebody's cognitive skills are affected. There's a lot of variability from one person to another person with the same diagnosis. Even if we can take a picture of their brain, I'll show you some examples here, that also doesn't tell us how their cognitive skills are being affected. So I'm showing you two patients here and asking you to imagine only one of these patients has memory problems. You can't see that from their brain scan. They both look pretty good, equally good. And then we can sometimes have the opposite situation where somebody has, something clearly wrong with their brain scan. There's a structural brain lesion here that you don't need to be a radiologist to see, but patient one may actually be functioning really well, perhaps because it was a slow growing tumor and the brain had a capacity to adapt over time, and that person's actually doing okay. Where patient number two has a just as messy of a looking brain scan, but has corresponding deficits. Maybe in working memory and cognitive flexibility, the kinds of things that we just looked at a moment ago. So that's how neuropsychological assessment can help add color to the situation of how people are functioning with regard to their memory and other cognitive skills. Related to that, we are sometimes asked to answer questions about looking at somebody's cognitive skills. Are they capable of taking care of themselves or going back to work, maybe following a traumatic brain injury or a stroke or something like that. Also helping to identify rehabilitation needs. So we may identify that they have a memory problem or, something even more specific, a certain kind of memory problem that would benefit from a certain kind of therapy, and that ends up being a recommendation following from the assessment. Another situation is where we want to monitor disease progression over time, especially cognitive change, maybe in the context of a neurodegenerative condition where things are getting worse over time, but maybe also we want to have more reliable way of determining whether some kind of new therapy or drug is helpful. And so we would do some testing before they start the treatment, and then at some point later and do a direct comparison. And then there are some other situations that are less common that I won't get into here in the interest of time. Where to find a neuropsychologist? So they are sometimes attached to hospital-based programs. There's not a lot of them to go around, but many programs within the Vancouver Coastal Health system and adjacent health authorities have at least some neuropsychologists attached to some neurological and psychiatric programs. So if you're already in one of those programs who has a doctor who spends time in one of those programs, you may have access there. And the other benefit is, those are MSP covered services. Not everyone does, and so there is also neuropsychologists who provide services out in the community. They are typically fee for service, although can be partly covered by insurance, or in some cases, like with ICBC funding for a motor vehicle accident, maybe fully covered. And I'm just highlighting here one website, referral.psychologists.bc.ca. It's maintained by the BC Psychological Association. They have a helpful search tool where you can plug in what you're looking for, and it will give you some names of people in your community. And you just notice that one of the ticky boxes here I'm showing is for neuropsychological assessments. And then one other resource for finding neuropsychologists can be at training clinics. So these are university-based programs that train neuropsychologists. We have one at UBC. So if you're interested, this would be the website to visit here, or if you just type into Google UBC Psychology Clinic, you'll see near the left, there's a tab called Services, and then I think it might be under Adults or Assessment. I'm not entirely sure. You can find some more information about neuropsychological assessments and how to get a referral. I just want to spend the last few minutes talking about a new offering within the BC Brain Wellness program, and that is cognitive health screening. So we just launched this recently. We're starting with a pilot of probably about 15 people, and I believe that pilot is already full, or that offers have gone out for the first 15 available appointments. But it is something that we're looking at running over the longer term with multiple offerings per year. And I'll just describe a little bit about what's involved there. So we're offering cognitive health screens, which are not sort of full-on neuropsychological assessments as I was describing for the last 15 minutes or so, but kind of a smaller version of that. Still more, quite a bit more than the brief, 5 to 10 minute test that you might get at your physician's office. So somewhere in between that and a full-on neuropsychological assessment. So these cognitive health screens can help identify cognitive impairment or decline. They can also provide some detail about the kinds of things that are difficult for people, but we can't do the sort of comprehensive profiling of strengths and weaknesses that we could with a more detailed assessment. And the other thing they're helpful for is kind of getting a baseline of where you're at now, in case you're interested in starting a new therapy or concerned about decline or what have you. Our plan is for people who go through the cognitive health screening program, who get feedback about the results and are interested in doing something about their cognitive symptoms or concerns, is to offer a cognitive health class. So this has not been entirely fleshed out, but what we're planning on is 6 Zoom classes lasting about an hour and a half each, starting in the fall. Again, this would be for people who've completed a cognitive health screen with us. And the cognitive health class would cover a little bit of general education about how cognition works. We would look at some things that get in the way of cognitive health, the lifestyle, stress, that kind of thing, and look at managing those things, minimizing their impact on cognitive health. We'll give an overview of memory strategies, compensatory strategies, skills and tricks, that sort of thing, because memory we find is the most common of all cognitive concerns. And then a little bit more detailed work on learning strategies for helping to remember what you hear and read, which is again pretty common thing that people describe: remembering to remember, remembering to do things, follow through on things. When you walk into the room and sort of forget why you're there, that would be an example of difficulty remembering to remember, and problem solving as well. So I will leave it there. We have a new email address specific to this cognitive health screening program that you're welcome to reach out to, and I've included my own email address just below there. So I'll just leave that up for a moment while we start the transition to our other speaker here.
Alrighty, okay. Thank you so much, Dr. Silverberg, for such an informative presentation on neuropsychology, screening its role, and also the exciting upcoming programs we have being offered. We will now move on to Yolanda's presentation on nutrition. So I will pass the Zoom mic to you, Yolanda.
All right, thank you. Thank you, Lydia, and thank you, Dr. Silverberg. All right, so now we're gonna switch the topic a little bit and talk about the nutrition and brain health. While I'm speaking, feel free to do a little bit of stretch and stand up and walk around a little bit in the room. And just for the consideration of time, I will just directly dive into my part of the presentation. Of course, like if you need to eat some snack, feel free to do so. I know it's lunchtime, so nutrition is very important. So make sure you have fuel for your brain. All right, so let me move on to the next slide. Okay, so for my part of the presentation, I will first touch upon the role of nutrition in brain health, specifically the pathophysiology, so how nutrition can impact the development of disease and the symptoms management as well, for people who are living with certain brain-related disease. And then we will move on to the nutrition program that we are launching at the Brain Wellness Program, and we'll touch on the specific components of that program. Okay. Before I start, I'm interested to know, have you seen a dietitian before? You can use the chat box at the bottom. And if you've seen a dietitian, you can enter 1 or just say yes. If you haven't, you can enter 2 or say no. I'm not able to see the chat box. If Lily, if you can just give me an idea of how many people seen a dietitian.
Yeah, we actually have, sorry, 1 is yes. So yeah, we actually have a good amount of people who have seen one.
Okay.
Yeah, good mix.
That's good to know. Definitely, like as we go through the presentation today, you'll see how like a dietitian can play an important role in terms of the nutrition management and the overall health with or without any brain conditions. Next question. Which of the following best describe you? You can enter the ABCD. A, I'm confident with managing food and nutrition in relation to overall health and disease management. B, I have a fair amount of knowledge about nutrition, food and nutrition. C, I don't know too much. D, I don't know anything about food and nutrition. A little bit for the response.
We have a lot of Bs.
Okay, that's good. All right, so so it's good that you're already having a fair amount of knowledge. It's great to hear. So hopefully today's presentation can give you some reassurance to know that your knowledge is backed up by evidence, or like give you some new food for thoughts and open up a different perspective in terms of nutrition and disease management. All right. So our brain is the control center of our body. All of your thoughts, feelings, and actions begin there. Despite all the wonderful things our brain can do, there are a wide range of disease and disorder can affect how our brain function. As you can see listed here are some common ones. They can alter a person's behavior, personality, and their ability to process information and function in their day-to-day lives. So it range from neurodegenerative disease like Alzheimer's disease and Parkinson's disease to mental disorders like anxiety, bipolar disorder, depression, etc. And also to other categories like stroke or traumatic brain injuries. So it vary quite a bit, and then it cannot have like just one approach of nutrition management for all different kind of disease. However, a theory have been brought up in the recent years of literature is the gut-brain axis. You may or may not heard of it, but what it means is there's this bi-directional communication between our gut and our central nervous system, so our brain and spinal system through the microbiota. So the microbiota are the living organism in our gut that can help us break down some of the food that we eat and create some beneficial metabolites that can circulate in our body. So this bi-directional relation, one way that is that our the dysbiosis or like the abruption, the disturbance of our gut microbiota could impact some of our brain-related conditions. And on the other side, our brain-related condition can cause some symptoms like constipation or delayed gastric emptying of our digestive system as well. So this theory applied into many of the diseases we previously mentioned, even though the specific mechanism is not proven, but there's definitely different theory of the possible development of the disease impact by this gut-brain axis. So I put here is an example for gut-brain axis interaction in Parkinson's disease. So for one side, you can see is the potential pathophysiology, so how the disease is developed. So the theory is that it could start with gut dysbiosis. So like I said, it's the interruption of our the microorganism in our gut. And then with the disruption, there could be the increased permeability of our gut wall. And then there could be interstitial inflammation. So the inflammation are along our digestive systems. And with that change, it can further cause like a systemic inflammation. There could also be the protein component change in terms of Parkinson development. And after that, there could also the inflammation could cross the blood-brain barrier and could impact the our neural system and lead to neurodegeneration, and it could impact our energy metabolism and could cause oxidative stress as well, and overall neural inflammation. So that's kind of the theory of how the diet or our food, our dietary habits could impact the gut and thus the development of the brain-related disease. And on the other side, after we develop certain disease, there are symptoms that could impact our nutrition management and absorption as well, such as the hyposmia, hypoglycemia, like I mentioned, the constipation, delayed gastric emptying, or certain movement disorder like tremor, dyskinesia, rigidity could all impact how how much energy we use every day. And well, these other symptoms could impact how much nutrients we're able to absorb through our digestive system. And I'm going to move on to the next slide. So how can nutrition program help with the management? So I break it further down to different aspects of how symptoms could impact our diet quality and nutrition status. So like I mentioned, there are certain conditions that it doesn't only restrict to Parkinson's disease, also apply to some other neurological disease or movement disorder disorders, pardon me, such as hyposmia, like the loss of smell, hypoglycemia, loss of taste, the depression, the delayed gastric emptying or constipation. All of these could impact our appetite, that can further impact our food choices as well. And if we have reduced appetite, we might not able to get enough energy from our daily food intake, and may later cause malnutrition or certain nutrition deficiency. On the other side, the safety and efficiency of food handling, how we chew food and how we swallow food, could also impact how much nutrients we get. Things like dysphagia, so the difficulty with chewing and swallowing, or like some motor symptoms like tremor, rigidity, bradykinesia, dyskinesia, and as well as cognitive decline, can all impact how we eventually able to put that food in our mouth and enjoy our food. So that could impact the nutrition intake as well. And on the other side, how much energy we use could also impact, like we mentioned already. It either can increase the amount of total energy we use every day, such as if we tremor, if we move a little bit more, or like rigidity, if we move a little less and not able to exercise as we used to, that can impact, that can change either like increase the total energy expenditure or decrease it. And I already touch upon like in the food choices, depression or apathy or like the loss of taste and smell can definitely impact our food choices, and impulse control disorder can also change what our food choices. We might not able to choose things more consciously versus before. And dietitians can play an important role in managing those symptoms and kind of help you with still getting enough nutrients and energy through our food. And certain of things such as the safety and efficiency of food handling, chewing and swallowing come hand in hand with what speech language pathologists and occupational therapists can help you with. So if you haven't heard of those health professionals, it's also something that you can search upon and explore a little bit more. But today we'll focus on the nutrition part. Here is a nutrition hierarchy. The kind of showcase what we would kind of navigate through whenever we see a new client. So at the bottom of the pyramid is the energy balance and calories. So the question you might want to ask yourself is, am I getting enough to eat? Do I feel tired throughout the day? Do I have enough energy for exercise? Did I notice any muscle or fat loss? Or if I have like a continuous weight loss or weight gain over time. And if that one is covered, you don't notice any of those things. And you can also ask yourself, is your plate is balanced with grain, protein, and food cooked with healthy fat, and also the fruit and vegetables in your daily meals. And if that is also checked, then you can ask yourself, am I eating a variety of food? Am I including all the food groups in my diet and eating a rainbow with food with different colors? And if that's also met, you can also ask yourself, how many meals and snacks should I have per day? Do I feel hungry or have low appetite at a certain time of the day? And I might experience any food-drug interaction, and also like how can I optimize my meal to support my exercise, for example, at a certain time of the day? And if those questions got answered, then we can also come down to, are there any nutrients I'm not able to get from the food alone? Then we can talk about certain nutrition supplements, or like certain functional food, such as the prebiotic, probiotic that's also been studied a lot in terms of brain health. So I know that on the internet or like just kind of a popular topics is always like a superfood, or like certain food ingredients can help, or like a certain nutrients like a vitamin B or vitamin C help with certain disease management. Unfortunately, there's not like enough evidence to support like a specific, for most of the cases, there's not enough evidence to support a specific food ingredients, food items. And we tend to, like when we see our clients, we tend to focus on like the overall healthy eating patterns. And we will talk a little bit more if we have time today. And this one I talked about in one of our previous presentation. I won't touch on too much today, but if you're interested, I will talk about the nutrition program, and we'll definitely touch upon those things in more details in our program. Okay, so now we talk about those questions and certain nutrition needs for related to brain health. Now, how can we meet those nutrition needs? Again, I won't talk too much details today, but basically a good starting point is follow Canada's food guide, and it's recommended to almost everyone. So rule of thumb to make half of your plate fruit and vegetables, a quarter of your plate protein, and a quarter of your plate whole grain. And again, like this is not specific to, it's not tailored to any condition. It's not talked to specific client cases. So if you like do have question about your specific disease management, you might want to talk to a dietitian one-on-one, or in a targeted group class. And I know a lot of you might have questions about some common dietary approaches that you've seen either in literature or online. I would say the evidence for different diets is mixed. So I listed some common ones, and they're some common disease and the available literature on the different diets and the symptom or disease management. So for multiple sclerosis, for example, there's no strong evidence favor specific diet, but some research did suggest Paleolithic diet or paleo diet, and Mediterranean diet may reduce the MS-related fatigue and improve physical and mental quality of life. However, the evidence usually low quality and need to be confirmed with more high quality research. And for epilepsy, there's a good amount of evidence suggests ketogenic diet will help. And this is actually one of the main application of ketogenic diet in disease management, and modified Atkins diet and low glycemic diet is kind of developed recently, with like the focus on higher fat and lower food that will trigger a quick blood glucose increase or blood sugar increase. I won't touch on too much detail here. Move on to mental disorders. Again, there's limited evidence. Some evidence suggests Mediterranean have a protective effect, but again, like most of the study is observational study, so we can't say that having a Mediterranean diet can cure or just is related to we cannot see that having a Mediterranean diet can cure mental disorders or for sure will cause the decreased symptoms of mental disorders, but there's definitely like a correlation. So we know that if you're following a Mediterranean diet, you might have reduced risk. And the evidence for like specific, like I said, specific vitamins, supplements, or mineral or like fatty acid supplements is mostly inconclusive. And if anything, it's also kind of related to specific conditions. If they have a certain deficiency, then it might benefit from supplementation for sure. And for neurodegenerative disease, mostly observational studies. Again, like it's just a relation. Like we know that following this diet might relate it to reduced risk, but we don't know if it will kind of cure or like prevent it for sure. A lot of studies underway for sure, but so far we know that Mediterranean diet is associated with lower risk of Alzheimer's disease and Parkinson's disease. So does MIND diet, it's related to reduced cognitive decline. There's insufficient evidence for ketogenic diet on Alzheimer's disease or Parkinson's disease so far. And there's also no sufficient evidence that dietary supplements or certain food intervention can reduce motor symptoms. And lastly, for stroke, there are association of certain food groups with stroke risks, like fruit and vegetables intake is associated with reduced stroke risk versus like red meat or especially processed meat might related to increased risk. And Mediterranean diet also, from literature, we know that it might inversely related to the stroke. And Japanese style diet is also mentioned in some of the literature to related to reduce mortality risk of stroke. So that's kind of like, it's not comprehensive. It's kind of some of the most common ones mentioned in the literature, and it's by no means like I did a like summarize in the most scientific style. Usually if you want to summarize how like a certain diet impact a certain disease, it requires groups of researchers and spend months and years to look through all the evidence and make a more comprehensive summarization. But hopefully this gave you an idea of what we are in terms of the dietary intervention on certain disease management. And if you decide that you want to try a certain diet, make sure you value the benefits, evaluate the benefit and risk, right? This example is for intermittent fasting. For intermittent fasting, I think it shows pretty well that like certain benefits, like a potential health benefits, like reduced disease risk, or weight loss may or may not be a benefit for you, and reduced overeating, again, like just possibility, it might not for sure reduce that, and it might not be a concern for you, right? So the benefits really individualized, and the risk as well, you really need to consider if this diet is sustainable over time, like we're actually able to do this for the rest of my life, or until the time that it will generate a positive result. And will it reduce the energy or my quality of life? Will that impact other health behaviors? Like, am I still able to enjoy my meals with my family and friends, right? And will this create a disordered eating pattern, for example, or promote food fixation? So for the diets that are more restrictive, we might really want to consider the potential risk, and you might want to discuss this with a dietitian. And as you see in the previous slides, like some common diet mentioned in the literature, like MIND diet or Mediterranean diet or DASH diet, those are relatively have less risk because it didn't exclude any food groups. And it also kind of have like a similar focus on a certain health food groups or ingredients like we touched upon, like the fruit and vegetables, or kind of reduce the processed meat or red meat. So those have relatively less risk, and you might feel more confident to start without consulting a dietitian. But like, again, like the main idea there is to, have a diet that's abundant in fruit and vegetables, nuts, herbs, spices, and legumes, and probably avoid or have less food that will promote inflammation. And of course, like if you're able to have a personal nutritional intervention, it might help with the manage disorder as well. Bottom line is to include all food groups in your diet unless it's indicated by your medical team. Avoid having really restrictive diet patterns. And if you do need to follow, or you're really hoping to follow a restrictive diet for a certain reason, make sure you talk to a registered dietitian. And now we're going to move on to the nutrition program side. So this content is created by Jessica and Jennifer, who are dietech students, had their management placement at our program. Considering the time, I'll just skip through a little bit. But the focus of the program is to improve the nutrition status by providing you the knowledge and skills to make informed dietary choices and decrease the risk of certain nutrition deficiencies and malnutrition. And the second objective, or the goal of our program, is to increase the food literary skills. So we want you to be more confident in the kitchen and able to create a balanced meal with whatever condition you're in, or it was like any restriction, like financial restriction or time restriction that you have. So hopefully the program can help with that as well. And we also want to promote social connection. So with our online, especially group classes, we hopefully will connect people and able to share our recipes or share our tips in cooking or nutrition management with each other and have that sense of community. So with more specific component of the program, one is the teaching kitchens. So this one, we haven't have specific details lined out yet, but the idea is to offer mostly virtual, and if possible, maybe we can offer certain in-person spot and have it hybrid. And the amount of classes is not again set yet, but likely to be either monthly or bi-weekly. And this will launch with the fall program and brain wellness program. And I will show you where to find the class later from the website. And again, like our goal is to make sure you have increase your food literacy skills, was able to prep a balanced meal, able to read food labels, able to budget your grocery purchase, and develop cooking and kitchen skills. And on the other side, we hope to increase the quality of life by promoting social connections and better the management of side effects and for your general well-being as well. Again, I will show you how it looks like on the website. And the other component is a one-on-one nutrition counseling. This service for now is just open to people with Parkinsonism for now, just due to the funding source, and also just open to people in British Columbia due to the our dietitian license. However, it's not limited to people in certain clinic, and you don't have to have a neurologist to refer you. You can self-refer, or like any other health practitioners can refer you as well by filling out the referral form. And we are offering our service based on your nutrition risk, and then the first comes, first serve. Okay, I'll show you where on the website to find that. So if you open if you search for Brain Wellness Program and open our website, and you can find it under at the top, classes and our classes. And you will see the food and nutrition component is the newly added one on top of the already existing ones. So on this page, you will see the one-on-one nutrition counseling, and there's the referral form there for you to complete, and also the upcoming programming. So likely the in-person or virtual nutrition workshop, And before we start, we do value your input. So if you want to fill in the survey, just let us know what format or types of the programming you would like to see in our nutrition program. As well, like if you're not able to join any of the programs for now, feel free to click on our nutrition resources at the bottom. And we have certain small nutrition tips on protein or fiber, fluid management, as well as some recipes that developed by our dietetic students here that you can look at. You can either look at online or you can download our resources and print it out and look at it at your own time. All right, so that's a very quick looking through. And at the end, I would say if you not able to get into our program, there are also other resources there. There's online resource for older adults in general. There are, again, like some developed nutrition handout in terms of the macronutrients or some symptoms management, nutrient symptoms management you can find on this link here. Again, I will share that the slides with you guys afterwards. There's also the Parkinson BC resource site. There are some previous presentations and slides regarding nutrition and Parkinson's disease. There's also, you can also ask your health practitioners to refer you to or certain clinics, depends on your specific conditions. They might have outpatient programs there with dietitian. And lastly, if you have the resource to, or if you would cover the cost, or if you have health insurance coverage, you can also look to see a private dietitians, and you can find a dietitian that meet your needs from Dietitians of Canada or BC Dietitian there. Okay, so sorry for like stretching a little bit over my time, but that's my part of the presentation, and I'll pass it on to Lily.
Alrighty, thank you so much, Yolanda, for such an insightful presentation. I know it is already 1 p.m., so before we dive into the Q&A, we'll do the Q&A for sure. This is technically the official end of our seminar, so thank you everyone for joining. If you do have to log off, I thank you so much for joining, and I'm wishing you a lovely rest of your week. So yeah, let's get into the questions. Let me just scroll to the top here.
If it's helpful, I can see the chat and that the first few
Yes.
questions are about neuropsych stuff that I can sort of rapid fire answer.
Yeah, that would be great. Yeah, if you can.
Yeah, sure. Okay, so the first question is about including increasing stimulation or interruptions during testing as kind of a reality check if somebody is ready to go back to work. That is a great question. The answer may be surprising is no. We, in order to do that well, I think need to get into kind of virtual reality and other methods of realistic simulation. What neuropsychology does well is assess the sort of skills that underlie the various complex things that people need to do at work. So for example, people have to multitask at work, and that can look different for different people, but what we can assess is the kind of components that you need in order to multitask, such as cognitive flexibility, as we talked about, disengaging from one thing, switching to another, back and forth, and so on. Working memory, keeping multiple things in mind. What was I just doing? What do I need to get back to? So that was a long way to say, no, we don't do that, but that's why. Can neuropsychologists help with schizophrenia? So this is actually a really good example of a condition where, for the most part, people's brains look normal on brain scans or whatever else. And there's a huge range of cognitive difficulties. Some people can have major problems. Some people can actually function pretty well with schizophrenia. So neuropsychological testing can be helpful to figure out what somebody is capable of, what kind of help or accommodations they might need. This comes up a lot for young adults. That's typically when schizophrenia starts. Some of them can be successful in university, but you wouldn't think so based on their diagnosis. So we need to assess and figure out that actually they have pretty good memory, pretty good this and that, and might need some accommodations or support. But yeah. So the short answer there is yes. Assuming cognitive health testing in class is part of a research project, no, at least not for the foreseeable future. So we may at some point ask people, what they thought of the program from a quality improvement perspective, but no, we would not ask you to sign up for a research study in order to be involved in that. At least we don't have immediate plans for that. Only 15 to get into the assessment, so only those can get into the Zoom class. Yeah, that's right. So we think it's helpful to get a sense of how people's cognition is from the health screening in order to suggest whether the class will be helpful for them or not. So that's why that kind of sequence. So again, the first 15 is just kind of, we're going to try this out and work out some kinks, but our hope is to offer that on an ongoing basis. IADLs, yes, I'm sorry about the acronym. Activities of daily living, getting yourself around the community, paying bills, cooking, all those kinds of things that you need to do day in and day out. I think that's all for me.
Thank you so much. So let's move on to the nutrition questions for Yolanda. The first one is there any information on how gut issues versus conditions that affect the large intestine, such as diverticular disease and / or gallbladder removal?
Thanks for the question. There are definitely some guidelines, I believe, for nutrition and diverticular disease, and perhaps with the gallbladder removal. I'm not super familiar with that part. However, that's not my expertise. If you like the resource I shared before, you can reach out to perhaps private dietitians who are more specialize in those areas, or if you would like to, talk to a clinical dietitian at the outpatient clinic, you can see if you can ask your care practitioners to see if you're eligible for that referral as well.
Alrighty, thank you.
I would say that's definitely something that you can look into, because nutrition and diverticular disease is definitely related. Like, so I can't say too much about certain components like fiber, and as like important ingredient in your food is pretty important for diverticular management as well. Yeah.
All right. We also have a question on any thoughts on the all meat / carnivore diet.
So carnivore diet, I would say it have a lot of red flags. I don't know, like, what's your consideration, like, in terms of following that diet. But like I said, if a diet limits your food to only certain food groups and eliminate other ones, that would increase your risk of having nutrition deficiency. So if you're following a carnivore diet, I would say you're not having any fruit and vegetables, and you're not having any grain products. And so that will be like no fiber in your meals, and there will be like no carbohydrates, I guess, in your meal as well. So like some people argue it's the type of ketogenic diet. And even though that it might, change the how your body use the energy, instead of using sugar, you will use fat. But it's, like I said, it's a balance of benefits and risk. We don't know if changing from sugar to use the fat is that beneficial, and on the other side, with the risk, you're eliminating all the all the minerals and vitamins that you could get from fruit and vegetables, you could get from whole grain, and also the fibers you're able to get from there. And also you're also, like, with higher intake of animal-based food, there's also probably increase with certain fat, like saturated fat, which we know is related to the increase of LDL. That's, like, some people call it bad cholesterol, which is related to increased risk of cardiovascular disease. So I would by no means recommend that diet. But yeah, if you have like specific consideration, I'm happy to discuss further as well. Yeah.
All right. All right. Just in the interest of time, let's just do 2 more questions, and then if you have if you still want your question answered, feel free just to send us an email directly, and then we'll get back to you through Yolanda. So the next one is there any research done regarding gluten intolerance and brain disorder like foggy brain?
Again, like I'm not super sure about that. I can look into that and get back to you. Yeah.
All right, perfect. So the last question we will address is there appropriate ongoing research for diet and neurological health so that we eventually get long-term data?
Sorry, pardon me. Could you please repeat the question
Yes,
again?
for sure. Give me 1 second. Is there appropriate ongoing research for diet and neurological health so that we eventually get long-term data? So I guess just like any ongoing research happening right now.
Yeah, there are a lot of like, I would say longitudinal studies. There's one at our movement disorder clinic at DMCBH as well. We're following people with Parkinson disease for a long time. I'm not sure if there's like a more like inclusive longitudinal study with all kinds of neurological disease. I imagine that would be really hard to conduct, but I'm sure there are like a longitudinal study on certain types of disease that will be follow up over years.
Thank you so much. All right, so that is the official end of our Q&A session. Let me just put our email in the chat if you want to send over any remaining questions. I believe that is our email. Yes, that should be correct. All right, so yeah, thank you so much, everyone. Wishing you a lovely rest of your week.